Good afternoon, everyone. I'm Daniel Smith. I'm President and CEO of Cooperative Network. Welcome to our webinar today on a very timely subject. I know we have spent the last almost a year now dealing with the effects of the worldwide pandemic and COVID in the workplace. And today we're bringing to you, our members, two very knowledgeable companies about how you can overcome some of those challenges and plan forward for the future. We are joined today by Alexander Kempe and Chip Kubley of Novir, a testing and medical company that has been working with COVID situations across Wisconsin. And then we're going to follow up with a discussion on the HR impacts by Jennifer Mead of Mead Consulting, a person that I've worked with for many years, and I have a great deal of respect for Jennifer's understanding of the issues that we encounter in HR in our businesses and our cooperatives, and especially when you're dealing with something as new and as challenging as keeping the workplace and your customers safe during this time. We will have the ability to take questions through our chat and our Q&A. Each presentation is going to take about 20 minutes. We'll start with Alexander, and then he'll turn it over to Jennifer and she'll talk on the HR thing. And then we should be able to, at the end, have a conversation and take some more questions at the end. So Alexander and Chip, welcome to Cooperative Network. Thank you for being here today.
Thanks for having us.
Thanks for having us. Yes, so, sorry, go ahead, Chip.
Oh no, I'm ready for you.
Great. We wanted to take you through what Novir does and give you an idea of how that could be of value to your businesses, and perhaps then find an opportunity to connect after the call. I'm Alexander Kempe. I'm the President and CEO of Novir. With me on the phone, I have Chip Kubley, who is the Director of Channel Development. And together we're gonna take you through an overview of Novir, and I'll kick it off. Novir is in the rapid detection solutions business for life-threatening infections. We are looking to try to drive earlier detection to allow for treatment guidance and monitoring that will allow for a quicker way to lessen the negative impact it has on health and society. The way we do this is with rapid point-of-care tests, specifically antibody tests and antigen tests. And to support that, we have a platform that allows you to digitize the testing process, comply with state and federal reporting, and give you visibility to manage the cadence, frequency, and frankly, anything you want with all the data that you're getting to allow for a better risk management model at the workplace or whatever point of care environment that you may be in. So our tests are smart, they're reliable, they're fast, and they're flexible. Our tests are these, and this is the lab. And this lab you can bring anywhere, and it's very inexpensive. In fact, more than 70% less costs. We're a local operation based in Wisconsin. We develop, distribute, and manufacture these tests. Our focus on solutions is vital to your benefit, as there is a lot of unknowns and there are a lot of gaps into COVID risk management at the workplace. So our focus has been to put something together that truly is end-to-end, where you don't have to cover for certain things on your own. We show up and it's turnkey, specifically around testing that is for COVID and any type of test, frankly, whether it's antibody, antigen, or PCR. We're a team of XG healthcare people, direct supply, a number of different businesses that have been around for a while in the healthcare space. And quality is something that we care truly about, from the supplier stage to conformity controls to quality oversight, and of course, complying with FDA. We are FDA registered site. We're also a CLIA certified laboratory. We work with a number of different partners that has collectively allowed us to be of your service in a productive way. And that is a number of different labs, academic partnerships for the clinical trials, such as medical college, telehealth platforms, which allows for, frankly, the future and self-administering the tests once that becomes available, manufacturing partners such as MPE, and so forth. The team has a significant experience in healthcare, and it's been around in the state of Wisconsin for a long time. We're early in the outbreak, and that is a very important part of what we communicate to the businesses we meet. We want the businesses to realize that this is not going away anytime soon, and that's even considering vaccine coming out. In fact, we want the mindset to be not a reactive one when it comes to COVID management. It should be a proactive one. It should be part of the planning process, because it's going to be with us for a while, at least 18 to 24 months. That period may shorten a little bit between the 18 and 24, let's say, with vaccine becoming available. But the right approach is to think about it long term and put it into your planning process, so it allows you to become proactive and not get into unproductive situations, cost inefficient, and risk at the workplace, frankly, that we also deal with in reactive testing scenarios. Another item that it's been controversial in the beginning, I think it's well known by now, is that the majority of people do not have or present symptoms. That does not mean they're not spreading the virus. In fact, asymptomatic people are as effective in spreading the virus as symptomatic people are, and the data and the science supports that. What this means is that any symptom-based efforts at the workplace will eventually cause an outbreak. It will not work just to rely on a symptom-based approach, and therefore you want to complement it with some other programs in place to allow for catching, if you wish, the asymptomatic side of things. Viral testing has been widely used and is the way to detect the virus, obviously. Particularly molecular testing, or PCR, as you know, is born out of the lab. And it's been a tool that's been put in place really to address symptomatic people, and something that the healthcare system is aligned well to deal with and to run people through the care pathway. However, again, the pandemic is in a large extent asymptomatic based, and we don't really have the opportunity to run everybody through a lab, which we've experienced the issues with in lead time, as well as capacity constraints. And we're seeing that right now again, since April. Young people are a large spreader of the virus, and we've seen an uptick in that significantly. We think that people need to consider this now, particularly around Thanksgiving, and how you handle it, and who is around the table, and perhaps what preventive measures you've taken to avoid, COVID from spreading. And the last thing I say is that the guidance, unfortunately, just hasn't really kept up with the evolution of the pandemic. Perhaps reacted a little late at times in coming up with guidance, and that's where we've built a lot of knowledge based on our team, the data we've gone through, and medical advisory board, which is global with people in Europe and in Asia, that allows us to understand a little bit better how other countries or environments are dealing with the managing the spread and managing at the workplace, because some of these countries may have been affected earlier than the US, in fact, and that gives us an advantage when we make some recommendations for people. I'm just going to kind of run through the curve here and the virus, and to give you an idea of what we think is effective use of tests. We believe that you want to use two tests. You want to use the virus detection test, which is PCR and antigen, and you also want to use the antibody test. And I'll go through the reasons here. So first of all, the first days of the virus, maybe up to day 5 or so, no test is real effective. And that poses a real challenge on us managing COVID, obviously. The virus continues building up the viral load in the body, but around day 10 or so, the PCR and the antigen test starts lapsing in terms of effectiveness, and the antibody starts building up in the body and becomes detectable at around day 7 and peaks around day 9 or 10. So there's that sort of transition between the two tests that occur, and that may be of value in indirectly detecting whether somebody may be infectious with IgM as an aid to diagnostic testing. But more importantly, the green, which is the immunoglobulin G and represents the immunity or immune response that now has been confirmed to be about 6 months, last study that was done, is a way to understand essentially if people had COVID or not, past infection. And this can become real useful if you have a workforce of 100 people and prevalence is up to, let's say, 15, maybe even 20%. Then those people, which make up a large part of your workforce, you may not have to test anymore, at least not for at least 3 months, according to CDC. So the point here is really to look at a combination of these tests as you implement testing programs. You don't have to. We recommend it. We think it allows you to detect a few more that may be infectious and allow for a 100% detection rate. But it, above all, will give you history with the antibody test, and you get all this rich data that you can now take action on. This is really all about data, finding out where your employees are at on a frequent basis and be able to take action. And so both of these tests provide for a complete coverage if you wish in managing COVID risk at the workplace. We therefore provide for a model that's combining these rapid tests on a frequent basis at low cost over a large amount of people, where we get a test result really presented to us in 15 minutes. So these tests will generate results in 15 minutes or less, which will allow you to know essentially instantly whether somebody had COVID before, if somebody currently has COVID, or indirectly perhaps detecting if somebody may be infectious. And that's very important information, and it allows you to manage the risk at the workplace much more effectively. It has a secondary effect on the healthcare system, providing for less burden on the healthcare system, if you wish, that's already overwhelmed. So you're also doing the community a service. If you're deploying proactive testing programs, you will be affecting the community in a positive way and trying to manage the spread and take action much, much quicker. And where it makes sense, then people should be taking a PCR test, which is more expensive. It should really be targeted. And that strategy helps allow for that sort of funneling to take place. The tests we're talking about here are the antibody test and the antigen test using a lateral flow assay technology. It's known in the pregnancy tests, and it's been around for a while. So it's a proven technology that's now being applied to COVID, in this case, successfully. These tests are reliable, they are inexpensive, and they get very quick results. They work in 2 ways. The antibody test is a simple finger prick, a prick of blood that you will put into the cassette, and then cassette will then give you an answer whether you're IgM positive, IgG positive, or both, or in fact negative. As it relates to the antigen test, it's a nasal swab where you collect specimen, and you will then, together with a fluid in a little bottle, drop that into the cassette, and it will give you either a negative or positive. All of this can happen pretty much in any controlled environment at the workplace. And the results are present within 10 to 15 minutes, so you can take action right away. Our program is one that accounts for a testing protocol that really reaches an end-to-end solution where we start with the risk assessment. We look at your business and try to figure out what are the components of your business, the different groups, type of profile you're at, and what risks are associated with your type of business. We also have this platform that would allow to capture your voice of your employees, but also allow you for capture consent to the adequate data fields necessary for federal and state reporting that are required. And then a number of other interesting elements of information to capture a risk score that gives you insight into your employee base and how to better manage COVID. That will then help us define a protocol and a cadence for your business that has a mix between these two tests that we can discuss and agree on what makes sense. And then we can actually come on site to do the testing and provide for the actionable data and give you access to the platform so you can track progress and you can take the necessary action to address your employee base and really maintain a safe workplace. And that's one of the things that came across as we have implemented this program across private and public companies, manufacturing, schools, service industry to some extent, is that the employees give results that indicate that they feel much safer at the workplace, because you're essentially putting everybody in the same boat with a testing program that's proactive, and it provides for a safer environment, not only quantitatively, but also quality-wise for your employees. And so that's a background to Novir and our testing capabilities and what we do. I'd add this, that we can work out how we can address your business in different constellations, but we're going to talk about on-site testing today, but we can also help remotely in certain ways as well. Chip, did you want to cover a little bit here about the two case examples we had in mind with the Midwest food manufacturer as a profile and how we would handle that and what it would look like?
Sure. Did you want to bring that slide up?
It's up.
It is. All right. Let's see here. I'm maybe not sharing the right thing here. Here we go. All right. So we looked at two types of organizations. One, a manufacturer. In this case, we picked a company in the food business, food manufacturing with multiple locations, including a corporate office located, I should say, locations located within Wisconsin and Minnesota, obviously. We kind of looked through the different segments of the business. Where we look at the production side of the business, we have a much higher risk profile there, just people working closer in contact with each other from just the population. I don't know if it's as true today, but earlier at the onset of the pandemic, we did see certain risk profiles were elevated for certain minority groups and things of that nature. And we look at the office, we see that there's much less risk within the office environment as opposed to the production environment, so on and so forth. From there, we would come into each of the corporate locations, both production and office settings, where we would establish a baseline testing protocol to kind of form the bubble around each of the production facilities as well as the office. And then after making risk assessments based on our baseline testing, would then enter into cycle testing for each of the production locations. And we also looked at, did you have anything you wanted to add there, Alexander?
No, that's good.
All right. And then looking at more of an office structure where we might have multiple smaller offices. Typically, we're looking, in order to make the testing efficient when we come in to do it, we're looking for somewhere around 50 to 60 people or more in a particular setting to run the testing event. So if we were working with an office-based entity where we might have multiple offices that have 15 to 20 employees per office, what we would do there is actually pool the testing, where we would arrange to have a testing location near multiple offices, and then we would do pool testing there. We'd set up in that one larger office, and then on an appointment basis bring employees in from other locations to do the baseline testing there. And then again, once we have our results of our baseline testing, we would then embark on a cycle testing or surveillance testing program for the remainder of the offices. Anything you'd like to add there, Alexander?
No, I think that's great. So these just are two examples of two different businesses, but we're very open to customizing, to your needs and working things out. And if you have healthcare personnel accessible, we can, work something out as well. So that's the overview of Novir and the two examples we have. We'd like to turn it over to Jennifer Mead now to give an overview from an HR perspective.
Thank you. I am Jennifer Mead, and I am an HR consultant. I provide HR consulting services to small and medium-sized companies, typically companies with under 100 employees. So I provide services from hiring to recruitment to retirement and everything that happens in between. Of course, over the last 8-9 months, a big chunk of my work has been COVID related. There's a lot of things to navigate through. Even if you have one employee, you're on the hook for some of the different programs and resources that are available to employees as a result of some COVID relief packages. So I'm going to pull up a PowerPoint here. Sorry. So I'm going to touch on a couple different topics here that have been really popular with what I've been dealing with lately. It's the FFCRA and the Emergency Paid Sick Leave Act. Just some HIPAA that has to do with COVID, and then unemployment. And then typically in the HR world, when I do roundtables or things like this, the question and answers is the big part, because every employment experience is individual and there's so many things that could come up. So I'll be happy to answer any specific questions that you have towards the end. So the FFCRA, what is it? If you haven't heard of it, it is a Families First Coronavirus Response Act. It requires employers to provide paid leave to employees for very specific COVID reasons. This act is currently in effect through December 31st, 2020. I do not know if they will pass legislation to expand this into 2021. I am not seeing anything right now that indicates that they will. So employers are responsible to abide by this through December 31st. There is a posting requirement that you must have if you are a qualified employer under this, and I'll get to that in the next screen, that you must have posted in a conspicuous area with all of your other state and federal regulatory postings. This one's a pretty simple one-pager PDF that I can send to you, and I've placed my email address on the screen there. If you want to email me, I can drop you a copy of that PDF that you can just print and get posted. Again, right now, the posting requirement's only through December 31st, but it's good to have it up if you are a qualified employer under this. So basically, this provides paid sick leave, like I said, under 6 very specific COVID-related scenarios. You may request a tax credit for these wages via your quarterly 941 tax return. So there isn't a super long delay for you to get your tax credit for these payroll payments. And so what I always tell my clients is I don't do payroll, I do HR. And so most of my clients work with payroll providers or with CPAs. You just want to work under the guidance and according to how your CPA or your payroll provider wants you to code this, but you 100%, anytime you're paying under FFCRA, code it differently as your pay, because then it will be easy to draw that out and apply for your tax credit right away on your next 941 quarterly statement. So generally, who's required for this is any employer who has under 500 employees, and they get 2 weeks of paid sick leave for situations that are related to their own personal, and I'll get to those specific reasons. If it's regarding their own personal absence, like they've been required to quarantine, they get 100% of their pay for up to 2 weeks, or an equivalent if they are a part-time employee. And then they get 2/3 of their pay for some other scenarios that are not for their own personal medical reason. Part-time employees, what I've been telling people is use a 6-month look back period to determine their average work hours. So at this point of, into this, this was a lot different in April when this first came out, when people may have been working their regular hours. At this point now, if people are working a reduced schedule or their part-time hours are incredibly variable, you definitely want to take advantage of that 6-month look back period, because you would pay them their average hours for a 2-week period for the last 6 months. So here's where the eligible employers in general, if you have less than 500 employees, you are required to abide by the FFCRA. Now, there are certain industries and certain types of employers that are exempt from that. And if you think that that might be you, we can look into that, and I can give you, guidance on if you could be exempt or not. If you choose to take the small employer exemption through hardship, you don't necessarily need to submit anything. What I've been telling my clients, and I haven't had one client that has taken advantage of this yet, but early on, I had advised them, write up your case, write up your business case. We'll save it. The only way you'd ever have to present it is if somebody filed a Department of Labor complaint against you that you violated their rights under the FFCRA. So it's not necessarily a submit and you get exempt from the law. You can make that decision as an employer, just knowing that you have to defend that decision if a case is brought against you. For the expanded leave, which is an additional 10 weeks in addition to that first 2 weeks. So the first 2 weeks is the Emergency Paid Sick Leave Act, which is a portion of the FFCRA. Individuals who are impacted for reason number 5, which we'll get to in here in a minute, which is care for a dependent who has lost daycare or school, you get an additional 10 weeks at 2/3 your pay. Now with that one, you have to have been employed with the employer for at least 30 days before the leave request was made to be eligible for that. Whereas the Emergency Paid Sick Leave Act, everybody's covered on that from day one. So the reasons are here. So reasons 1 through 3 are the ones that are paid at 100%, that you are basically advised by a medical provider that you should not be at work, either due to exposure, due to pre-existing medical conditions that put you at a higher risk, something like that. 4 through 6 are where you're caring for somebody else, and that is paid at 2/3 the rate of pay. Reason number 5, which is the one whose school or place of childcare is closed due to COVID, is where you can get the additional 10 weeks. There's a lot of caveats here. The first one is if your employee is able to, and you allow them to telework or work from home, they are not eligible for FFCRA pay. So they should just be working from home. You should be paying them as normal. You would not run that through FFCRA. So telework is a big point here. Some important things to remember. The employee's ability to take their time off for their COVID-related absence cannot be contingent on the FFCRA approval. So if an employee says to you, I need to take some time off, I've been exposed to the virus, I'm going to get a test, I'm not coming to work this week as a result, the response back should be, okay, well, you may is the key word here, you may be eligible for pay under the FFCRA. We never want to promise that, because as everything in life, nothing's for free. So this isn't free money for the employee. This isn't free money for the employer. There is documentation, and very specific documentation, that needs to be in place. And if you don't collect that documentation and you get an audit of your FFCRA claim and you cannot provide that necessary documentation, you will not get the tax credit back for that money. So then you will be assuming the risk of paying the employee for that money or those wages as you had in the past. So it's very, very important to tell the employees that they must complete the election form and they need to provide the necessary documentation for that time to be paid under the FFCRA. Maybe you approve the time off, but for it to be paid, it has to have the appropriate documentation. Then I also tell people, keep your documentation together with your quarterly 941 documents, because again, the way you'd have to present that is if you got audited. So it just seems logical to keep it with that 941 documentation. If you get audited, they would notify, or they would say it was for a specific quarter, and you'd be able to just pull all that documents, provide the necessary documentation, and move on your way. You get the tax credit first. You may have to prove it later via an audit. So it's in your best interest to have all the documentation in place. So that's the FFCRA. There's so many complexities to the FFCRA. I have been reviewing them case by case basis every time they come in for a client. You know, with the school one, I don't know if this will let me go back up. With the school one, it's important to note that if the school district is offering in-person and virtual instruction and the employee has chosen to do virtual instruction, they're not eligible for the FFCRA for that reason number 5, which is caring for a child whose school is closed. Now, if they're doing in-person instruction and they've sent the children home for 2 weeks or a certain period of time, and they can produce a letter from the district that says your child may not come to school, that would be the appropriate documentation that we would need to pay them under the FFCRA. So it's super important to look at each one individually and not make blanket statements on this. HIPAA, the one thing I just wanted to talk about here is just remember, when you are making notifications to coworkers and or company-wide announcements or customer announcements about a potential exposure in the workplace, do not mention any names. That could be considered a HIPAA violation. 99% of the time, they can figure it out, especially if it's a small office. John Doe has been out for, is out. Nobody knew he was going to be out. He's going to be out for 2 weeks. It's pretty easy to figure that out, but you as an employer do not want to specifically say their name. That would put you in a place of liability. I wanted to also touch on unemployment because I am doing a lot with unemployment right now in a lot of states where my clients are, and every state addresses unemployment differently. I am in Madison area, so I am in Wisconsin, so I'm super fluent in Wisconsin unemployment, and I've become pretty fluent in other states really quickly as a result of this pandemic. The important thing to note is never promise unemployment to an employee. The companies do not determine unemployment. The state does. So it's always, what I always say to people is go ahead and apply. Our role as a company is to respond to the state with factual information, and the state will determine your eligibility for payments. If the employee didn't qualify for the FFCRA pay and you're requiring them to be out of work, let's say you have an employee that this weekend they're going to travel to family out of state, or they've shared with you that they are going to be sharing the holiday with their family. And as an employer, you don't feel comfortable with them coming back to work on Monday as a result. And you've now required your employee to self-quarantine for a week or 2 weeks or how long you're determining. Because you are forcing them to quarantine, and they haven't come to you and said, I've had an exposure, I can provide the documentation, I need to be off work, that is something that potentially they may be eligible for unemployment for that time away because the employer initiated that separation. So what happens is whenever an employee applies for unemployment, you as an employer, you're going to get a notification that your employee has filed for unemployment. There's going to be dates, there's going to be reasons. Your job is to review, if you're in Wisconsin, that's the white form. It's your job to review that white form, make sure that the information is accurate. If it's not, you correct it and you send it back. If it is accurate, you don't need to respond at all and let the state make their determinations. The other thing that's super important is watch your weekly unemployment reserve statements. These should come weekly. If anybody is drawing on your unemployment account, you will get these weekly. It is really important to watch these because there are a lot of fraudulent unemployment claims going on out there. I spend a lot of time on the phone with unemployment, calling them and letting them know when someone shows up on my client's account that shouldn't be there. So let's say they were laid off, they came back and then they quit, but they found a loophole to continue to collect their unemployment. They technically shouldn't be collecting their unemployment because they quit. So unless they were fired from somebody else and they're drawing off your account, it is very important to let UI know when you have a quit notice because they will escalate that to adjudication and look into it. And my opinion is, I'm going to, play by the unemployment's rules. I'm going to let them know if something doesn't look right, but I'm letting them make all the decisions. It's super important that the employer isn't like leading or, helping unemployment to make decisions. Your role is to give them the data, give them the factual information and let them make the determinations. I will tell you that every employment rep that I've gotten on the phone when I've called on a reserve statement has been very grateful. Unemployment will eventually run out of money or have some issues at some point. They don't want to be paying these people unemployment any more than you want that coming out of your reserve account if it is a fraudulent case. So it's important to let them know. And at least in the state of Wisconsin, they view it as our responsibility, the employer's responsibility, to be letting unemployment know when someone shows up on your reserve statement that you do not believe should be there so that they can adjudicate that and make sure that everything is legitimate. So unemployment is a super hot topic. I am still working Wisconsin cases from people laid off in March, and we're in end of November, and I'm still working March cases with unemployment. Their infrastructure was not intended for the volume that they've had over the last 8 months. And there's a lot of errors happening. So you have to do your due diligence to be really diligent in looking through everything you get to make sure that everything is where it should be. That's pretty much it as far as the prepared stuff that I had. I am happy to answer any questions. I am available for consultation. I've put my phone number and my email up. It's always nice to have an HR person like myself in your back pocket to help you through all these anomalies and all these different things that come up and happen. I will say that if it's not in your budget as a small employer to have an HR consultant, because that can get costly at times, I would say also if you are offering group benefits to your employees, sometimes brokers who offer group benefits, I would check with them because they sometimes have like a 1-800-HR option for you that's either free or maybe a little less expensive than working with an individual HR consultant like myself. Same thing with your payroll provider or your CPA. There may be some free options out there available to you. The only thing I would caution is those are canned HR services. So they may not be able to dig into something specific. They might be able to, if you called and said, okay, here's what my employee told me, am I on the hook for FFCRA? They might be able to give you like a yes or no answer. But as far as dealing with like employees, like specific employee situations, sometimes those canned HR, 800 HR lines can't give you that specific guidance, or they're going to charge you for it. So that's kind of what I do and what I help out people with. So I guess I will maybe turn it over to the Q&A and answer any questions that people might have.
Thank you so much to our presenters. And like it says here, of course, put any of your questions in the Q&A or into the chat, and we will wait a couple minutes to see if any questions come through, and we will address those at this time. And if there are no questions in the next minute or so, we will end the webinar.
I'd like to ask a question, Michael, first with Alexander. We have, several cooperatives that may have several hundred employees. They may be scattered across a dozen different works places in Wisconsin, and they're really performing essential services. So whether it's in the food processing industry and the dairy processing, where they simply need to have hands-on work, it cannot be remotely changed to a remote workplace, or farm supply cooperatives, electric cooperatives that need linemen out in the field, or delivery people. When you have that many different work sites and performing essential services, how does your program help? How can your program help a cooperative just manage through that burden?
Yeah, that's a great question, and a very challenging one with, sort of a hub and spoke model, or maybe even various hubs and a number of spokes. I think, we would have to look at it in more detail. Our initial approach is going to be to cover for a proactive approach at the critical mass sites, and then ask if there's an opportunity for people that naturally come in to the hub, so to speak, to be there at certain times, so we can actually take advantage of them being there to conduct the proactive testing. So that would be the first approach we take. If that doesn't work, then we would figure out perhaps even how we could do a remotely supported initiative with remote training, remote platform availability, and really sending out the kits and working with their healthcare service personnel that they may have, or that may be on site, or we can make available, and see if we can work it out that way. Over time, however, it is our plan to apply for self-administered tests, and that's going to take a little bit of time before they get authorized by the FDA. But when that comes around, then we can do pretty much all of this anywhere at any time, and you'd have our platform to support it, which is an instrumental part of visibility and data.
Okay, thank you for that.
Sure.
Alexander, we actually have a question for you as well. Kelly Christensen is wondering what the cost of the Novir program is per test, or what the cost of the program or the cost per test.
Sure. We look at a pricing, when it's volume, that is about $60 per test, which includes the administration of that test. So today, the FDA and the EU authorized tests, they require a healthcare worker to administer the test, especially these tests that most lately have been approved for point of care. And so it's greatly reduced the cost, because before that, it had to be a lab. So they run about 60, and then there's, potential site fees and in other circumstances. But just looking at the test plus the administration, it's about $60. I think over time it will come down. We can see how that's going to come down with, $10, maybe even $20 over the next 3 to 4 months, depending on how efficiently we can organize the cost structure behind it. And especially if you, on your side, you're able to actually provide for the healthcare at, service administration.
And then we have, thank you, Alexander. And then we have a question for Jennifer. Do you need parental consent to test minors? And that might be for Alexander as well.
I think that one's more for Alexander.
Sorry, yep.
Yeah.
Yes, no, there's a consent process frankly, for anyone that's built into the platform. So we're testing schools right now, and part of that process is to have a parental consent. And that's built into our platform. It's digitized and very straightforward.
Thank you. Are there any other questions at this time? I see Jennifer put her her email into the side there. Alexander, maybe if you want to put your email into the chat as well, so that if folks have questions for you, they can reach you there.
Yep.
Well, I don't see any other questions at this time. So Dan, if you want to give a couple of closing remarks, we can let everybody off a couple minutes early.
Sure. Well, one thing, I don't think it's the best news to share in the world, but I did listen to a podcast by Bill Gates this week where Bill Gates said that our challenge is not only to manage through this pandemic, but to prepare for the next one. And that in his estimation, that next one would be here within 5 years. So I think we're all hopeful that this is a 1 in 100 year event, which we often hear of, but I don't think we can rely on that. So thank you very much to our presenters for bringing this information to us today. I know our cooperatives are dealing with this every day. It's new. We have to deal with this at the same time we're trying to run our actual businesses and keeping our cooperatives working. So we appreciate your expertise and your being with us here today. If these webinars that Michael does such a great job of arranging are recorded and available on our website. So this was complex information that we got through today. Please follow up with our presenters, visit our website if you would like to go back and go through the webinar again. We will continue to bring webinars to our members on the issues that are most pertinent to you. In the future, we'll be doing director training webinars. We will also be doing in the new year a series of webinars on executive succession planning for the cooperative, whether it's new directors, whether it's a new CEO that the cooperative is going to have to reach out and hire within the next couple of years. Just how do you go through the succession planning process so that you get the continuity that you need in your cooperative. Thank you so much for joining us today. I wish you all a wonderful Thanksgiving. Most importantly, stay well, stay in touch with Cooperative Network. We're here to support you in any way we can. And thank you one more time to our wonderful presenters today. Thank you all.
Thank you.
Thank you.